This video aims to provide information about pressure ulcers, how and where they occur, and ways to reduce the risks of development. A pressure ulcer occurs when skin and underlying tissues are damaged by pressure on that area. They are usually caused by the weight of your body pressing down on the skin, or where the layers of your skin are forced to slide over one another. For example, when you slide down in a wheelchair or transfer into the wheelchair. This is known as shearing. Pressure ulcers can also be caused by friction, where the skin is frequently rubbed. There is a higher risk of development when a person becomes immobile and finds it more difficult to change position, or has reduced sensation and therefore cannot feel discomfort when sitting. Pressure ulcers occur over the bony points of the body. As you can see, there are many locations of bony prominences. In lying, particularly with the head of the bed raised, there is more pressure over the coccyx compared to when seated. There is also more contact with the heels and spine on the bed. There is a risk of shearing around the sacral area as a person is more likely to slide. In sitting, there can be pressure points behind the back of the knees, particularly if the seat is too long. If there is asymmetry of the pelvis or reduced muscle bulk, the ischial tuberosities, the bones at the bottom of the pelvis, could be vulnerable. Other areas that are susceptible to pressure ulcers could include the coccyx if the pelvis is tilted backwards, the spine, elbows and the head, particularly if in contact with the wheelchair or headrest. There are many risk factors that can lead to pressure ulcers developing. Some are related to factors about the person, including diet, reduced mobility and sensation, or a history of pressure ulcers. Others are external factors such as posture, the amount of time spent in the wheelchair, friction and shearing. There are ways to reduce the risk of pressure ulcers developing, including spending less time sitting in one place. Wheelchairs are designed as a mobility aid to assist moving from one place to another, and not just designed as a comfortable seat. Try transferring onto another surface after using your wheelchair, or spend shorter periods of time sitting in the wheelchair. When seated, it is also important to try and keep moving or adjusting your position regularly. Having a good nutritional intake can also impact a person's skin. Therefore, eating a balanced diet and drinking enough water is very important. Maintaining a good hygiene routine can also be effective in reducing the risk of pressure ulcer development. Avoid sitting on wet or dirty covers for a long time and ensure that continence is managed. Be particularly aware during hot weather, as the heat can cause moisture between the skin and the cushion. Make sure the person transfers to and from a wheelchair safely by using the correct equipment, for example a hoist or a sliding board. Try to prevent skin being rubbed by not touching static surfaces when moving, for example using a sliding sheet. Shearing can happen when a person is not positioned correctly in the wheelchair, or the wheelchair is not meeting their postural needs. As you can see in the video, as this person slides, the distribution of pressure changes, with more weight being taken on the sacrum and coccyx. The pelvis is not designed to bear weight through this part of the body, and this can lead to changes in the skin around this area. One of the best ways of preventing a pressure ulcer is to reduce or relieve pressure on vulnerable areas. This is done by moving around and changing position as much as possible. As you can see from the pressure mapping equipment, even leaning from side to side or forwards can help. The NICE guidelines recommend that if you are at high risk of developing pressure ulcers, to change your position at least every 4 hours. You may be advised to sit for less time, as any pressure ulcer prevention plan needs to be based on an individual risk assessment, taking many factors into account. If a person has limited movement, they may need to have assistance to change position from someone else, including lifting arms or legs, or helping them to lean forwards. As you can see, even small movements can change the distribution of pressure. It is important to regularly check skin, particularly around vulnerable bony prominences. If you or your carers notice any discoloration of skin, persistent redness, blue or purple coloration, swelling that may be warm to touch, shiny skin, blisters or areas of discomfort or pain, It is important to contact your GP and the community nursing team immediately. If the pressure ulcer is in a location that is in contact with the wheelchair, please also contact the wheelchair service.